Hi, I'm Dr. Aileen Cohen, Executive Medical Director at BeiGene. I'm so happy to be here with two ambassadors for the Lymphoma Research Foundation. In observance of the 10th Annual Blood Cancer Awareness Month, we're having a conversation about patient experience for those living with blood cancers today, the advancements that have been made in blood cancer treatments in the past decade, and our hope for the future of blood cancer research and development. I'd like to turn it over to Bob and Erica, our two ambassadors. Can you tell us a little bit about yourself and your connection to the blood cancer community?
My name is Erica Campbell. I am a stage 4 Hodgkin lymphoma survivor of 7.5 years. So I've been a part of the blood cancer community for 7 years. 6 years since getting past my diagnosis. My journey, I'm sorry. So after my diagnosis, after going through my journey with cancer, I decided to just dive in, supporting other fighters, their family members, their loved ones, being a part of organizations like the Lymphoma Research Foundation to pretty much to bring hope and courage to those that are newly diagnosed, to help inspire them and uplift them during this time.
Bob?
Hi, my name is Bob, and I'm a 20-year lymphoma survivor, mantle cell lymphoma survivor. I was diagnosed in 2000, and certainly looking at today, there are so many more treatment options available than when I was diagnosed. I ended up having chemo treatments in 2000, 2001. We followed that with a autologous stem cell transplant. I relapsed in 2004. I had a treatment of rice, which was very, very difficult. And then we followed that with an allogeneic transplant. Again, a much more difficult treatment. And looking back at that and looking right now at the 10-year mark for Cancer Survivors Month, the difference in treatment is unbelievable. It looks to me like treatments that are much more easy to tolerate. And of course, that's the goal. I've been very fortunate so far. I've been with Lymphoma Research Foundation for over 10 years. And it took me a while before I wanted to talk about my experiences. But I thought, I've gone this far. I've done pretty well. I thought I'd want to share some of those experiences and help others and provide some, let's call it inspiration to continue with their journey.
So along those lines, Bob, what do you want people to know about blood cancer?
Well, when I first started this 20 years ago, doctor says I have lymphoma. I said, what on earth is lymphoma? No idea. So I think I think we need to have people become more informed what to expect. And one of the things I do is I go to one of the reasons I went to organizations like Lymphoma Research Foundation is to go to their various conferences, become a more informed patient.
Mm-hmm. And Erica, same question to you. What do you most want people to know about blood cancer?
Definitely be more informed, being up to date with informative information, learning about the latest research, the changes in treatments. And just like Bob stated, I like to go to the different conferences and, do my own research online to see what has changed so that myself, I am always keeping up with what's the changes in the research and things of that nature. So I definitely want people in my community to know that with blood cancers, you know, it's two words that scare individuals that are newly diagnosed, their families. Is definitely scary, but like myself, having faith and just having the support, the great support, my family, my friends, I knew that, you know, I can beat it, and I did. And I'm here today to be able to give that same hope to others.
What are some of those challenges that you might have faced?
Whew. Yeah, I faced a few challenges throughout the 6 months and 12 rounds of treatments that I did receive. MRSA, shingles. I was in and out of the hospital, blood clots. I mean, I had different things that transpired throughout my journey with cancer. But again, I just kept pushing. I didn't give up, you know, and that's all I know how to do today is to keep pushing, because although I am a survivor, I still have moments. So with those moments, I want to share with other people to give them hope and inspire them as well when they do have the different challenges like myself.
Well, I agree with that. I think that you really have to push yourself. I remember way back when, after a couple of my transplants, just walking again was a challenge. I started, first I was able to walk down the stairs of my house, then I would walk down the block, then I would make it to the park, and then into the park, and eventually 2 miles. And that was like I was delighted. It took a lot of effort, but each day I pushed a little further to get back to what we call the new normal.
Yes.
So I'd like to answer some of your questions, you know, as a clinician. When you were diagnosed, what is it that you might want to have answers to from researchers or people in industry or about clinical trials that you didn't get answered, or what sorts of questions might you have?
My question would be in regards to, you know, when you're working with organizations like the Lymphoma Research Foundation, and what is BeiGene's mission? What is the guide, your roadmap to working with organizations like LRF with research and things of that nature in the blood cancer communities?
Yeah, so as a company, BeiGene really does want to engage and listen to the patient story. We're heavily into and focused on patients, and really trying to get the drugs that we develop not just to local places or even the global markets, but really trying to extend it you know, beyond. And really that's one of the places where organizations such as LRF can help us do that. I mean, we want to hear from the patients about their experiences, how we can better improve drug development or the patient experience on the trials. Meanwhile, we'd also like to, you know, get feedback about our drugs themselves, what's working, you know, where we can better, you know, help you. In terms of research itself, I know that BeiGene is focused on trying to promote patients getting together and promote, like what you're saying, educational opportunities out there so that people can learn, because being diagnosed with cancer is a very scary proposition.
Yes.
I know when I'm a pediatric hematologist oncologist by training, and I know, you know, going into the patients when you're giving that first diagnosis, they hear nothing, or at least the parents, you know, in my case, and you have to go through it, go slowly, really try to hit the key points, because, you know, they're going to come back, all they're hearing is, I have cancer.
You know, I think that one of the things that doesn't come across, like you said, a person is scared and all they want to do is, well, make me better. But somebody doesn't have the questions ready to ask. Like, what kind of treatments? How effective are they? How long will they last? What are the side effects? Those are all things that don't really necessarily come out.
Yeah.
What different treatments are there? Is one better than the other? and certainly everyone's different, but I know 20 years ago, there weren't as many options, and you went with what the doctor suggested. I was fortunate to have a team that really did well.
Yes.
And steered me in the right direction.
Yes.
I still remember the one time when I relapsed and we went through more chemo treatments, rice, and then it came to the point, well, if you don't do the allo transplant, it's just going to keep on coming back and you're going to have to do more treatments.
Mm-hmm.
So that was it in a nutshell for me. What choice did I have? But nowadays, when you hear an allo transplant, that's not exactly something that's necessarily recommended up front.
Mm-hmm. Yeah, no, it is really nice to see where the field has come from 10, 15 years ago, when really what we had to offer were different chemotherapies. And not to say that chemotherapies don't have their place, because even today chemotherapies are very effective and really do play a role in the treatment paradigm of blood cancers. But really being able to look at the biology of the cancers at hand and be able to look at those signaling pathways and put targets that those cancer cells are really dependent on, and inhibit that and stop those cancer cells from growing. Back to one thing that you were saying before though, Bob, is, there are all these different choices and possibilities, but I think that's where the patient-physician relationship really comes into play, in terms of understanding what the patient's needs are,
Definitely.
what their goal is of the therapy. Can either of you comment on that?
Definitely. I'm sorry, Bob.
Go ahead.
No, and that's very important, to have a great relationship with your physician, your oncologist. Is like, my relationship with my oncologist was amazing. I felt like I was the only patient and she is the director of the cancer center, and I felt like I was her only patient, because any questions, any concerns that I did have, she answered them. I was able to text her. She texts me back till this day. Very supportive. And like you stated, it's very important to have that connection and that support from, like, that one-on-one support from your oncologist, to know that, you're not being ignored. You're not singling. She's not putting you, or he's not putting you in this box alone. So that's always a plus.
That is important, very, very, extremely important. And I'm going to say that I had a similar experience. My doctors were just fabulous, and I could call at any time, whenever I didn't feel well, or had questions after a treatment, what to do.
So has COVID-19, the pandemic, affected your work with?
Yeah, COVID-19, I think, has affected everybody in different ways. So in terms of the conduct of a clinical trial,
Yes,
we require folks to come in and be seen. It's really important for adverse event reporting, so that we have knowledge of the comparative drug safety. It's really important to get efficacy scans on time. So the majority of our efficacy, or at least in part, is reliant on frequent CT scans. If it's a progression-free survival, meaning that you haven't had your disease progress yet, that's picked up by the CT scan. You can see that sometimes before you actually have symptoms of it. So if you're trying to compare two drugs to see which one progresses or takes longer to progress, it's only going to be as good as your sampling. So, say one drug has a progression at 7 months and one has it at 10 months, but you only take the scan at 10 months, you're going to think they're the same, because they both will have progressed at 10 months. Mm-hmm. So by missing CT scans, we might be altering our ability to really, test and figure out the actual progression-free rate. Similarly, if you're looking at best overall response, finding out the time of that response is important also. And this is all, due to just trying to get the drug approved. For a given patient, it's not going to make that much of a difference. But for our studies, it really does potentially have impact.
So a question for you in regards to taking an actual pill over receiving a regimen of the chemotherapy, do you see in the cancer communities, blood cancer communities, that patients are choosing that specific treatment over, well, the pill over the actual chemotherapy regimen? Were you actually there at the cancer center?
Yeah,
Or
I
it
think,
all depends?
yeah, on the whole, when we talk to our investigators, they're, making the offer of chemotherapy or the newer therapies, and in general, they're preferring the newer therapies.
Mhm.
Anything that moves the research forward can only help all of the blood cancer community. And I think it's that research that's really moved us from where we were 10 years ago to where we are now. And I think that's what will take us from where we are now to the next 10 years.
To the next 10 years.
Definitely.
Yeah. Just out of curiosity, do you also see patients?
I stopped seeing patients 4 years ago. Like I said, I'm a pediatric hematologist, oncologist, and I had been adjunct at Stanford up until 4 years ago. It really, it was one of those work-life balance combination things. Long and short, I am not anymore. I do miss it.
Yeah.
I was wondering about that because one of my doctors does both, and it's I guess, limited patience, but try to continue with both. And it's kind of hard, I think, but I think there probably are benefits to both.
Yes.
Yeah. And
Yes.
Speaking of Bob's question about you working with patients, and you stated that you're not. Now that you're, working with BeiGene, like, what are you most proud of in regards to your work with BeiGene?
Well, the fact that we're having this whole discussion is the result of the drug development, and that just makes me happy. But it actually kind of brings me back to BeiGene's whole mission is, cancer has no borders, neither do we. I remember when I had been at Stanford, I was sitting in a Grand Rounds lecture, and it was a lecture by Dr. Wee from St. Jude's. And this had to be in the late 90s. And he was talking about access in China to pediatric acute lymphoblastic leukemia, or ALL therapy.
Mhm.
And there, at the time, ALL, childhood ALL cure rate, and I mean cure rate, was for standard risk about 85 to 90%, greater than 90% potentially. And that was just with chemotherapy and that ability to understand the sequencing of the drugs. But in China, it was somewhere, I don't remember his exact number, but there was a substantial number of children dying from ALL because they did not have access to drugs.
Right.
And our whole mission of getting the drugs out there to everyone. I mean, China has changed. It has reimbursement. It moves things around there. It's much better than it had been.
Mm-hmm.
But that was something that really impacted me. And the whole mission of, being able to get the drugs everywhere at a reasonable price, rather than getting it to a few markets at a high price. Those are things that kind of resonate with me in terms of BeiGene. So I'm kind of proud to be part of that sort of mentality, I guess is the right way to say it.
Yes. Sounds good.
So to close out our discussion, I'm just wondering if Erica and Bob, if you can share with us what you hope to see in the next 10 years for the blood cancer community. If you have any final thoughts.
Yeah,
Well,
definitely. Like we spoke about earlier, eradicating this life-threatening disease. Like you stated, is some people, it's kind of hard to say the C word, but that is our hope, to find a cure so that we wouldn't be where we are today with so many cases around the world. So I definitely hope within the next 10 years, sooner, God willing, we can eradicate this disease.
well, Looking back, obviously, I'm dealing with 20 years, and what we were able to do 20 years ago wasn't anywhere near as what we're doing today. We can do so much more right now. There's so many more options. So, and it seems like options with a lot less serious problems, side effects, and so forth. And looking at what we've done in these last 20 years, or in the last 10 years, and then looking at 10 years down the road, who knows?
Who knows?
The goal, of course, is a cure. But again, as we've been talking about, is possibly a drug that you could just take indefinitely without having a lot of problems with it. And being able to live a very productive life. I think that's the bottom line.
And then it's like, you know, listening to Bob, it's like, okay, so once the cure is here, we eradicate this disease, then what would we have to talk about? So now, like, that's the next step. How do we come together? How do we discuss like different topics after the cure is here? So, I mean, although we want the cure, but I don't want to lose my friendships and conversations as well. So it's
no,
like,
I don't think that's ever going to happen, because you're going to have you're always going to have people that need support and,
yeah,
and some
definitely.
encouragement to continue.
To survive on, yeah, definitely.
Which is exactly why we both are part of Lymphoma Research Foundation
Yeah,
as ambassadors.
yeah.
To spread our stories and provide that hope and that lifeline for others.
Correct.
It's so important. It's so important because it really does allow people to know that they're not alone in this diagnosis.
Exactly.
And gone through it before and have come out the other side. And
Mm-hmm.
even if we're sitting there as clinicians talking to our patients and saying, you know, here's what you have, here's what it is. And we've seen people come out the other side. They, as an individual that's just heard this diagnosis, hasn't heard that. And that's where you'll always come into play, having an organization such as LRF.
Yes, definitely.
Yeah, my thoughts for the next 10 years in terms of where we need to be. I've already kind of alluded to it before in terms of best understanding how to sequence and use what we have. I think that will be important, but I think also the more we understand about the biology of the cancers and have that science drive those next targets, I'm sure that that's going to make a big difference, because I think what will happen, to Bob's point, is, you know, it's what we want is for people to die of natural causes, not die of their cancer, not have that be the thing. So if we can, I mean, even if we don't get to that cure word, if we can get a class of drugs here that extends you this far and another class that extends you this way, and then combining with another thing, just fighting it as best as we can on all different angles. And I think the research will hopefully deliver on that, like it has in the past 10 years going forward.
Absolutely.
Exactly. That's the goal.
Any last remarks before we close out? It's been such a pleasure to hear your stories and to have this fireside chat.
I just want to continue to survive so that I can continue to share my story and give hope, as we stated, to other newly diagnosed patients, their families, give them hope, give them courage, and continue to inspire from my end through my movement, Desire to Survive. I had a desire, and I want to give the same desire to others.
Thanks, Erica.
Well, that's exactly why I'm part of LRF. And when I was asked to be an ambassador, I was able to go to workshops, usually introduce an MCL speaker. And I still remember, this was 10 years ago, I was introducing a speaker, and this person comes up to me and says, "Wow, I'm just starting. Now I have something to shoot for." And lo and behold, I saw this person last year, which was around 10 years later.
Wow.
And she comes up to the table and says to me, "You're still around. I see all this stuff from LRF every year. And I said, Bob's made it, I can make it another year. And that kind of made me feel good.
Oh,
Absolutely.
that's amazing. That's great. Well, again, thanks you both for coming out today virtually. Would have been nice to be really sitting around a fire somewhere.
Yes,
Thank you. Thank you for having us.
thank you.
Such a pleasure.